in the area of FGM, just because we have that common goal for NHS England, for Metropolitan Police, for Department of Education, Department of Health, and all that is actually coming together because everybody has that common goal that we want to tackle FGM in London, and that's why all the strategies are geared towards that, to achieve that goal. Everybody is on the same page.
Women were petrified of giving birth. They were petrified of, seeing different midwife or a doctor every single time they had a maternity appointment.
FGM is one area where women are sometimes not approaching the health services. That could be the fear of being identified, or just the embarrassment, or they don't want to go through the same kind of feelings again. So it could be various reasons.
Plus, there is this huge cultural wall or taboo around the practice. So women do not come forward to say, I've had this, I do need help. So they never turn up for any kind of procedure which involves having a vaginal examination. My passion fell into this because I felt this is an area where people do not concentrate on. Now, because it's become a criminal offense, the government has spent a lot of publicity around it, but it was not so before.
The women who are not actually going for their cervical smear test because of so many reasons.
Particularly in this subset of women, they don't come for cervical screening. And we all know how important that is, because cervical screening is one of the most effective screening programs we have for any disease ever.
Or it could be a fatalistic attitude that we'll deal with whatever happens. At the moment, I'm all right, so I'm not going to go through that torture again.
So somebody can turn up to for delivery, and the midwives would not know what to do because the vagina is closed. So I started looking into it, and then I realized, strangely, in this country, although it's a criminal offense, we do not have a service purely outside of maternity. Maternity is when women are pregnant and they need to come to access healthcare. So we used to catch, if I can say, women with a problem. But once they stop being pregnant, there's no service for women to walk in. How can you not have a service?
So considering all those reasons, this cervical screening clinic was planned.
All these women who had nobody to speak to, they would come to my clinic, break down in tears. They had broken marriages, they could not have sex, they had been raped. And it's just a huge, people were traveling from outside London to come and see us. And that's when I thought, this is something we need to do. So I started another service where people could just walk in for the screening.
I was a victim before that. I did not confront myself for over 3 decades. And I happened to start working in a school, and there was a girl that I was working with, and the school had a suspicion. So that 10-year-old actually forced me to look at myself and talk about my own experience and write an essay on that. So that essay is what started me to become an active campaigner. Partnership is the most important part of any services.
It's hard to, for example, it's hard to get such service funded because we are short of funds any which way you look. This is London. So what we had to find ways and means around everything.
It is more of a partnership between health and social care.
I already had a clinic existing as my perineal vaginal clinic. So I converted one of that into this new clinic so that we actually embedded this service in an already existing framework.
Health officials, they are very qualified, but talking to people like us also enhances their work quite a lot.
You need to pull in not just your traditional team of doctors and nurses, you need to pull in very many professionals. The only way you can do that in future is by using partnerships like this. That's why I think this is fantastic.
Our project actually started in 2015, and it was supported by the Mayor's Office.
You need to have a program whereby you address that particular area to say, this is our population, this is the amount of resources we have, these are the amount of professionals we can bring together.
I come from local authority, and then we closely work with whips Whipps Cross Hospital, and we have close working with the local CCG and voluntary organizations in the sector.
I was the only survivor in the whole of UK to work with the local authority directly about FGM, and I became a female genital mutilation mediator for Waltham Forest Borough.
From Home Office, we got multi-agency guidance, but then from the London councils, there came another consultation. What kind of social care activities can be done to be supporting and tackling FGM? We formed a steering committee, and in that committee we had a representative from all the stakeholders, from social care, from Whipps Cross Hospital, and from CCG and public health, and as well as the voluntary sector.
Once you identify a need and you have a set of professionals who can feed in from different areas of expertise, and then the whole set works really, really hard, it is always a success.
And with that task force, we moved step by step, because you have to create referral pathways, and you have to actually create an awareness that you are starting a new service which can address to the people's need, and you have to reach to the different people and make the changes in the system to actually address those goals.
It's so important that we understand each patient, their own needs.
We were analyzing our strategies, that to what extent we are able to reach to the local community.
Every community has their own way of interacting with doctors. The communities like I come from, if the doctor is male, they're not going to tell them everything that they're feeling. They're not going to share things like smear tests. They will not do it, or actually go and get medication for the problems that related to FGM.
To publicize a service and to get women or patients to attend, that is the first hurdle because of language barrier, cultural barrier. You have every country, every culture in the world being represented in London.
And that made us look into this, what strategy can we do so that we can reach to the community 50 plus women, and then at the same time we can also offer them the services of cervical screening, say.
So people like me, I don't have a qualification like somebody in health department would have, but I have much more knowledgeable in terms of the community needs, community status, community wordings. How do they deem when somebody's talking to them? What kind of mannerism you need to have? What kind of language you need to use? All those things play a major role in order for NHS staff to deliver great work. And I think they are doing that. They are partnering people like me. And this is why we're seeing a lot of great changes happening in NHS. The Lotus Clinic proved how partnership is such a major thing, because we just started with seeing women who are pregnant, who have undergone FGM, and these women trusted the services so much so they went and brought in women who are not pregnant. So clinic expanded into non-pregnancy, and now it's expanding into smear testing.
We have started this clinic to kind of break the walls and the taboo around it. We've tried to make it as easy as possible for women to access the care. So they don't need to go to the GP, they don't need to ask anybody to bring them along, they don't need to check with the hospital, they can walk in at any time. So it is a walk-in clinic.
What this clinic did was divert the women who've experienced FGM to this clinic where I was there, where they can be assessed safely, where somebody that they can relate to was sitting there with them.
That we have three-pronged strategy where we are trying to prevent and protect and at the same time provide support and care.
We offer answers to all the problems associated with FGM. We offer cervical screening. So we offered deinfibulation then and there, because these women might not come back if you offer them an appointment to come back.
We offered psychological help, emotional help, and even physical help if they need it. The doctor was always there. So it is very important that we offer a holistic approach. We don't only target one door. You open one door, there's a million other doors connected to that. So we have to be responsible and be ready when we're talking to somebody, that if they open up about something, we are ready to give them that service. The
psychosexual counseling is so very important. This is actually the keystone in my service, because without the counseling, I can open up somebody's vagina, make them look beautiful, but if the woman doesn't believe that she's normal, back to normal, it's not worth any of my time. So the psychosexual counseling is key.
It's so important that we understand each patient, their own needs, and how to redirect them to what they need. So for us, health officials, they are very qualified, but talking to people like us also enhances their work quite a lot.
The social workers are the people who break down those walls and think, you can access the care if you like, we are non-judgmental. We have no opinion about your cultures, you come, you get treated, you go. So they are the ones who meet the families to go outside to the home.
They know that there will be somebody there that will make things easier for them, that the professionals themselves will have had knowledge and training, which is so important, training on how to deal with communities that they're serving.
My service would only function in 15% of effectiveness if I did not have these other multidisciplinary team members. Mm, 50% of the time, it's actually a clinical need, like they can't pass urine, but 50% of the time is making people happier, healing. So healing is not just about physical, it's about mental. So these type of services in a resource-limited area, it's still necessary for the whole well-being of the community, if I can use that word, not just the physical well-being, but the mental well-being and happiness.
In a way, I'm working in a very holistic way because our clinic is based on biopsychosocial model where we are addressing to the women's needs from all the aspects that we can address them. And we are able to create the services or create actually the referral pathways as well to give the women the support they require.
We did offer that holistic approach, which is very, very important when we are talking to the patient. It's not only one-way road, there's many other roads that that patient can take.
So we can tackle something like this which crosses culture, which crosses language, which crosses, oh, I have nothing wrong with me, I don't need to go to the hospital. So it makes it much more easier.
It's supposed to be a trauma, which it is, but I've kind of feel like it's, I use it as an educational tool, trauma that I use it as an educational tool to educate others. So it is my lifetime work, really, what I'm doing.
Because they don't have to go through the relatives or family or GP, more women are actually willing to walk in because they're not known in the community that they've accessed this service. So we hope it will increase the uptake.
Oh my goodness, it has made a lot of difference. They could trust one doctor and one nurse, which was Reba, and the midwife, Safia Ahmed, which made huge difference in terms of the women.
There was a lady who would not smile. Whatever I would joke, I'm very good, I'm a clown. I would joke, I would make them laugh. I could never make her laugh. So we deinfibulated her. She came back and then she was having proper sex. She came back for her next baby to the same team. She didn't want anybody, and she was smiling. Until today, she would not stop smiling. She sees us down the corridor, she'll come running, she'll hug you. She would not stop smiling.
Because women who've experienced FGM like me, we have a trust issue with adults. So for them to trust one doctor, especially a female, that's going to be constantly part of your pregnancy, it's huge, and it made so much difference for the community in Waltham Forest specifically.
The number of women who came to our launch, these are patients who came, who stood up, who cried, my mum could have had this, she would not have died of cervical cancer. And that's when you think, this actually really, really matters. So those are the kind of things that we carry around with us, and that's what we feel, this is so important. I think each patient of mine has a story, and I'm so grateful that we are actually part of that story. Now we kind of become part of their lives because they tell me that this was my marriage till this point, till I met your team. I mean, I say all of us, not just me. And this is how my life has changed. So I think that's absolutely amazing.
Actually, that gives me a lot of job satisfaction.
So to me, it doesn't exist as a clinic or a service because that's rather a cold word. To me, it exists on all my patients who I remember